My name is Lindsay with the Health Sciences Foundation, and I'm here in Cardiac Diagnostics with Dallin. And Dallin's going to explain to us a new piece of equipment that was funded by our donors and Thunder Bay 50/50 supporters. So, Dallin, I understand this is an ECG or electrocardiogram. What does it do?
Essentially what this device does is allows us to measure the electrocardiogram of a patient that might be in the emergency department for cardiac reasons or somewhere in the hospital for various other reasons as well.
And so basically they hook up all of these little nodes.
Yeah, so those are called our leads. What we do is we put stickers or electrodes on our patients in designated spots on their chest torso, and then we connect those leads to those stickers and allows us to see the patient's electrical activity here on this nice fancy screen. If one of our ends or an emergency physician in the emergency department thinks a patient might be having a heart attack or a myocardial infarction, they will quickly put in an ECG order for us to complete, and we'll hook up our leads to that patient and perform an ECG. It's a very quick test. It takes about 2 minutes to do, and we get a printout that we can easily hand off to that RN or that emergency physician right away.
That's awesome. So I understand that they actually do 4,200 ECGs on average a month.
Yes, as you know, time is muscle when a patient is having a myocardial infarction, so we want to get that done as quick as possible. So we do roughly 140 ECGs a day. That is an average, so some days obviously a little bit less, but some days are obviously a little bit more. So having this new unit here in the emergency department really increases our response time to getting these ECGs completed and in the hands of the physician.
That's fantastic. And again, this is thanks to our generous donors and Thunder Bay 50/50 supporters that we have another one of these.
Absolutely. This has been an absolute game changer in our department. I cannot tell you how much faster we are at getting ECGs. Our time is not being split amongst the entire hospital. We now have a dedicated machine in the emergency department, completing those orders for ECGs as soon as possible.
Well, thank you, Dallin, for taking the time to show us this equipment, and I'll let you get back to work.
Absolutely. Thank you.
Together we're healthier.